Hello, my name is Edric Lariano, and today I will be presenting a case study about Giardiasis. Typical patient presentation. A 28-year-old male came into his family physician with a chief complaint of diarrhea for over a week, with associated abdominal cramps, nausea, and vomiting, and some dehydration. Excuse me. Upon history, he stated that he went camping in the mountains of Arizona 2 weeks ago. Giardiasis is a diarrheal infection caused by the flagellate protozoan Giardia intestinalis, formerly known as G. lamblia. Infection is transmitted through ingestion of infections Giardia lambiasis. There are three ways how the infection can be transmitted. First is through personal person to person transmission that is often associated with poor hygiene and sanitation and is primarily mean of infection. Diaper changing and inadequate hand washing are a risk factor for transmission from infected children. Second is waterborne transmission is responsible for a significant number of epidemic in the United States, generally following ingestion of unfiltered surface water and those who drink in lakes and rivers. Lastly is through fecal oral contamination. Foodborne epidemics have been reported, most commonly secondary to contamination by infected food handlers. Another known cause is through oral anal contact during sex in homosexual individuals. For the background of Giardiasis, this infection is a global disease. It infects nearly 2% of adults and 6 to 8% of children in developed countries worldwide. Nearly 33% of people in developing countries have had Giardiasis. In the United States, Giardia infection is the most common intestinal parasitic disease affecting humans with more than 1.2 illness each year. Risk factors. Anyone may become infected with Giardia. However, those at greatest risk are number one, campers or travelers in mountainous western states because backpackers tend to drink untreated water from lakes or rivers, which makes them at risk for waterborne transmission, like in our case presented. Two, diaper-aged children in a daycare setting are at risk due to fecal-oral contamination. They are at risk of infection because of their developing immune system and they opt to touch things and put them into their mouths. Third one, homosexual men or men who have sex with men are the risk because oral anal contact during sex have been known to cause infection. Pathophysiology. A parasite is an organism that feeds off of another to survive. They establish a relationship in which the parasite benefits at the expense of other species. Water and food can be contaminated with protozoal parasites. As you can see in this table, highlighted in the red box, Giardiasis is included as one of the parasites important in human life cause of diarrhea. Life cycle. Giardia has one of the simplest life cycle of all human parasites. The life cycle is composed of two stages. First, the trophozoite, which exists freely in the human small intestine. And second, the cyst, which is passed into the environment. No intermediate hosts are required. Upon ingestion of the cyst contained in contaminated water or food, excitation occurs in the stomach and the duodenum in the presence of acid and pancreatic enzymes. The trophozoites pass into the small bowel where, where they multiply rapidly with a doubling time of 9 to 12 hours. As trophozoites pass into the large bowel, encystation occurs in the presence of neutral pH and secondary bowel salts. Cysts are passed into the environment and and the cycle is repeated. When Giardia lumbia inhabits the small intestine, then the trophozoites attach to the mucosal surface and are reproduced by binary fission. The small intestine will show signs of damage, wherein microscopically there will be shortening of microvilli, elongation of crypts, and damaged brush borders of absorptive cells. This ultimately results in mechanical blockage of the intestinal mucosa, which later competes for nutrients and inflammation. Furthermore, causing symptoms such as diarrhea, abdominal pain, nausea, and vomiting. Here we have a photo comparing a normal and infected intestinal epithelium with Giardia. The left side is an image of normal intestinal epithelium, and on the right side, an infected intestinal epithelium by Giardia lambia. Once infected by Giardia, the trophozoites attaches to the mucosal surface and cause cellular damage in the small intestines, resulting in shortening of microvilli, elongation of crypts, and damage brush borders of absorptive cell, which will further cause mechanical blockage, resulting in the symptoms mentioned earlier, which are diarrhea, abdominal pain, nausea, and vomiting, as which was manifested by our patient. Symptoms. The signs and symptoms of Giardiasis begin 1 to 3 weeks after a person has been infected. It may vary and can for weeks or longer. In some cases, people infected with Giardia have no symptoms. For our case study, the patient presented with Giardia for a week after he went camping 2 weeks ago. Acute symptoms include diarrhea, gas, greasy stools that tend to float or steatorrhea, stomach or abdominal cramps, upset stomach or nausea, vomiting, dehydration, loss of fluids. For the diagnosis of Giardiasis, because Giardiasis can be excreted intermittently, multiple stool collection, for example, 3 stool specimens collected on separate days, increase test sensitivity. The use of concentration method and trichrome staining might not be sufficient to identify Giardia because because variability in the concentration of organism in the stool can make this infection difficult to diagnose. For this reason, fecal immunoassays that are more sensitive and specific should be used. Rapid immune chromatographic cartridge assays also are available but should not take the place of routine ova and parasites examination. Only molecular testing, like PCR polymerase chain reaction, can be used to identify the subtitles of Giardia. To treat Giardia infection, effective medication include metronidazole, tinidazole, or nitazosanide. These are my reference. That's everything in my case study. Thank you.